Good evening, everyone. Today's topic is homeopathic therapeutics on disorders of puberty. So, without further delay, we will start today's topic. So, homeopathic therapeutics of disorders of puberty. So, what are the rubrics you can consider from Kent repertory? Genitalia female, menses before the proper age. See, this is precocious puberty. Genitalia female, menses before the proper age is precocious puberty. The remedies are antim crude, calcarea phos, chamomilla. So, I have considered only second grade and third grade remedies. So, antim crude, calcarea phos, chamomilla, phosphorus, pulsatilla, sabina, silicea. For delayed puberty, genitalia female, menses delayed in girls, first menses. This is the rubric. Okay, the remedies are causticum, graphitis, calicarb, natramure, pulsatilla, senecio aureus, and barytacarb. Okay, see, first of all, I want to share one thing with you. Any remedy can be given for precocious puberty, delayed puberty, or any disease symptoms if the rubrics match and if the materia medica matches. Any remedy can be given. These are only the examples. Okay, and I'm also showing you the rubrics because repertorization is a very important part in case taking. After a case is completely taken, I feel in my practice repertorization is very important. Okay, we have to repertorize, we have to arrive at a group of symptoms, then we have to arrive, like we will get a group of remedies, we have to confirm with the materia medica. Only then you can prescribe and that treatment will be effective, I feel in my practice. Okay, any remedy can be given. It is the list is not only so much. These are only a few examples, and moreover here it is more of exam point of view. Okay, this is more for exam. Of course it will help practice also, but how much therapeutics, all of you have a doubt. Most of you actually, in fact most of the students have a doubt how to write therapeutics, because you will definitely get all other material from the textbook. Okay, but you will not get therapeutics anywhere, that is which are, I mean, it's suitable for writing in the answer paper. Okay, you are getting confused. You are writing materia medica for therapeutics. Of course therapeutics is also a type of materia medica, but therapeutics is applied materia medica. Okay, you should never write common name, prover, family, all these things in therapeutics. That is all not needed. Therapeutics is application of materia medica clinically. Clinically applied materia medica is therapeutics. Okay, like how when we study anatomy there is applied anatomy. So like where there is, so the same way therapeutics is the application, how you apply the materia medica, how you differentiate the drugs, and how you apply materia medica in clinical practice is therapeutics. That is why it is called as therapeutics. Otherwise even university would have just said just study the clinical subjects and stop there. But the curriculum would have been designed only for clinical subjects, because anyhow we are studying materia medica, right? Anyhow you have materia medica from first year to final year. Then why again therapeutics is required? Because therapeutics is clinical application, it is practical form. Materia medica is theory, therapeutics is practical, how you apply to each clinical condition. That is why therapeutics is very important, and you should know how to study therapeutics and how to write therapeutics. Definitely you'll know materia medica. Okay, so here I am trying to shed light on how to write materia medica. So you may ask me, from where did you choose these remedies? So I have a justification to tell you that these remedies are given in Kent repertory, right? So like, but it is not final, that it is not that for all cases of precocious puberty you have to give this. No, any case, any remedy can match if the symptoms match, but these are the probable remedies is my view. Okay. Next. First, see, in writing any therapeutics, as you can see here, you have to write, like, most of the people who correct the answer paper expect therapeutics to be written in a format. At least I expect, because like that is what I'm telling you. There has to be a difference between materia medica and therapeutics. Okay. So for therapeutics, if you write under these headings, it is more than sufficient. If you write therapeutics like this, it is more than sufficient. Okay. Each remedy will be asked only for 3 marks. That is what you don't have 3 marks question. But if it is asked for 5 marks, there are 2 remedies will be asked. If it is asked for 10 marks, 4 remedies will be asked. And also third year right now, it is the first batch for CBDC, writing CBDC exam. So even therapeutics can be asked for MCQs. Okay. Single answer, like one line answer, MCQs also therapeutics can be asked. So only the writing therapeutics in this way helps a lot. Okay. So antimonium crude, characteristic keynotes. First write characteristic keynotes, then write particular symptoms, then write thirst thermals, because this will decide the generalities of the remedy. Okay. And general modalities. So like, and modalities also, even though I have named it as general modalities, even though they are general modalities, some of the modalities which are not at all related to the particular symptoms, I have omitted. Okay. And the source books here I have used are Kent Repertory, of course, Boric Materia Medica, Allen's Keynotes. That's all. No other book I have referred. Okay. These are the 3 source books which I have used, which I have referred to to build this therapeutics. This is a compilation. That's all. Nothing is of my own words. It is from the source books. Okay. So characteristic keynotes for antim crude. See, you can see here, for children and young people inclined to grow fat. So precocious puberty. See, precocious puberty is said to be, as you know, puberty is said to be precocious if there is development of secondary sexual characters before the age of 8 years, or if the girl attains menarche before the age of 10 years. So mother would come to you saying that she has already had menarche, okay, at a very young age, and she may have some problems. So in precocious puberty, how do you apply antim crude? So for children and young people inclined to grow fat, so the girl, when she comes to you, she'll be fat. Okay. And if you ask, like, if you probe more, if you ask or talk to her mother, she'll say she's always weeping. See, generally, like teenagers, adolescents, they have, especially girls, they have these new mood swings. They are sometimes happy, they are sometimes sad. But here, if you at all, if you are deciding with antim crude, the girl will be on this side also, thick milky white coating on the tongue. This runs throughout the remedy. This is like a red string throughout the remedy, what we say as red string throughout the remedy. Thick milky white coating on the tongue. This is with all symptoms of antim crude. Okay. Basically, see, antim crude basically is a gastric remedy. Okay. It can also be, as I told you, see, any remedy can be given for any condition, and any condition can be treated with any remedy. Okay. But some remedies will have affinity for some systems. So antim crude mostly has affinity for gastric disturbances, and that too, a girl who is fat, has gastric disturbances, and who has attained menarche at a very young age. You can think of antim crude, and especially that too, if the girl has thick milky white coating on the tongue. Okay. Next, particular symptoms. See, particular symptoms, what you have to write? You have to write about menses in the particular symptoms. If it is asked for precocious puberty, delayed puberty, dysmenorrhea, menorrhagia, metrorrhagia, you should not write symptoms of postpartum, abortion, or what do you say, labor, okay, or lactation. These symptoms you should not write in this. Even though the remedy, see, in female section of Boric, if you search, you will get all female complaints in that female section. But you should not write all female complaints. What we are asking you, which condition we are asking you for precocious puberty. So write only symptoms related to menstruation. Okay. So 2 toothache before menses. This is characteristic of antimonium crudum. Okay, next, menses too early and profuse. Menses too early and profuse. Menses suppressed from cold bathing. Suppressed from cold bathing. Antim crude is a chilly patient. Okay, so menses get suppressed from cold bathing. That is, she will not have menses if she has had cold bathing. If she will that month the menses may not appear because she has had cold bathing, especially like in summers. If she has had cold bathing, she would have not had menses that month, or it would be delayed. Okay, something like that. So cold bathing affects the menses. Next, leukorrhea, watery, acrid, lumpy. Okay, acrid. See this term you should remember. Acrid is leukorrhea. Acrid means it causes itching in the genitalia. It causes burning in the genitalia. Okay, so acridity means it causes itching and burning in the genitalia. Okay, so antim crude is thirsty, chilly, again aggravation, cold bath, acids. Acids doesn't mean she's taking acids or touching acid. No, acid means she's having pickles, or she's having food cooked with, like say for example, vinegar. Okay, Chinese food, all such foods. When she has such foods, when she has pickles, okay, when she has such foods, there will be aggravation. Stomach complaints will aggravate. That month she'll have problem with the menses. This is how we have to interpret aggravation acids. Okay, then aggravation after heat of sun or fire. So see, this may, you may feel contradicting. Even though the patient is chilly, she is getting aggravated after heat of sun. So see what it means. Heat of sun, that is, she has gone shopping in the sun, or she has been standing in the sun in a PT period. You're getting it, such things. Or fire. See, foreign countries, they have a fireplace. We are in India, like at least in our part, South India, we generally don't have any fireplace, artificial fire, or we don't sit in front of fire in winter. If we just wear some sweaters or something, that is enough to protect us from ourselves from cold. But in other countries or in other parts of India, in the colder parts, they expose themselves to fire. Okay, so after that the symptoms get aggravated. After that her menses may get aggravated. Okay, that is how you have to relate. That is how you have to correlate aggravation and ameliorating factors with the particular symptoms. Okay, amelioration, open air, not cold air, open air, and rest. So this is how you have to write therapeutics when you are asked to write therapeutics. So instead of just mugging up any book or mugging up any materia medica textbook, it's better you understand why that remedy is given in that condition. I'm not only talking about OBG therapeutics, all clinical subjects, OBG, surgery, medicine, pediatrics, dermat, ortho, ophtho, any subject you take that for that matter. Okay, so if you understand why that medicine remedy is given to that condition, you will definitely, it will be very easy for you to write therapeutics. Okay, hope I am clear with antim crude. Next is calcarea phos. Calcarea phos. Okay, characteristic keynotes of calcarea phos. So see here what Allen says: for persons anemic and dark complexioned, thin, spare subjects instead of fat. See, in antim crude, we saw the girl was obese. She had a tendency to obesity. Here, the girl is thin. Here, the girl is anemic and dark complexion. But it is not a compulsion. It is not that you will draw a line. If a fair complexion person comes and all other symptoms match, you cannot give calcarea phos. It is not like that. There is no rule. But most of the patients whom you should prescribe calcarea phos will be dark. That is what it means. You cannot generalize that all calcarea phos patients will be dark. Okay, it is just a clue. It is just it is just a direction in which you have to proceed when you are taking symptoms. Okay, girls at puberty, tall, growing rapidly, tendency of bones to soften or spine to curve. See, so here, there in Antim crude, that was the menstrual disturbance or precocious puberty in girls who have gastric disturbance. Here, precocious puberty in girls who have bone disturbances or locomotor system disturbance. Okay, so this is how you differentiate remedy. When you differentiate remedy and study, you can definitely remember. Therapeutics is not at all difficult. Okay, next, acne and anemia, anemic girls with vertex headache. See, acne, see, each word has a very definite meaning. Okay, see, all the textbooks of Materia Medica were not written just like that out of imagination. No, all the stalwarts, they have practiced, they have penned down all these symptoms out of their experience. Okay, these whatever they have written, Allen, Borick, Kent, Clark, Boger, all these people have written their experiences. It is not that they have just out of imagination they have written something. These are all their clinical experiences they have written. All of them have practiced for more than 30 years, 25 years, 30 years. So they would have seen so many patients. Okay, and that is how they have put down all these symptoms. So what Allen says in Allen's keynotes, acne in anemic girls with vertex headache. See, so specific. Anemic girls, precocious puberty, bone problems, okay, easy fractures, bone problems, acne with vertex headache, especially. And in Boric also it is there that calcarea fos, headache of school going girls or school going students. So of course, puberty is of school-going age only, no? So acne in anemic girls with vertex headache and flatulent dyspepsia by eating. So when she eats, she will have flatulent dyspepsia. That is, she'll have bloating and she'll pass more of flatus. Dyspepsia is indigestion and she'll have more of flatus. This is what this means. Okay, next, particular symptoms. Menses too early, excessive and bright in girls with violent headache. See, even during menses, there is violent headache. In Antim crude, there was toothache before menses. Here, there is violent headache, vertex headache during menses. Okay, and menses is too early and excessive and bright. If the menses is too early and excessive, it is bright. If the menses is late, it is dark. So it can be given for both conditions. That is epimenorrhea also at puberty, and also oligomenorrhea when it is delayed. Okay, blood is dark. Sometimes first bright, then dark. See, that is what I am telling you. These are not no, they are not out of imagination. These are clinically verified symptoms. These are seen in patients. So many patients. That is why these are written. Okay, if the menses is late, blood is dark. Sometimes first bright, then dark with violent headache. Again, okay. Then leukorrhea like white of an egg. There it was watery. Here it is like white of an egg. It is mucoid. In Antim crude, it was watery. Here it is like white of an egg. Again, the calcarea fos patient is thirsty, chilly, and aggravation from exposure to damp cold. There it was cold bathing. Here damp cold. Say for rainy season example. Okay. There it was cold bath. Here it is damp cold, changeable weather. That is when the weather changes from summer to winter, or summer to rainy, rainy to winter, winter to summer, that way. And mental exertion. Okay, so these are the symptoms of calcarea fos. Next, chamomilla. Chamomilla can be given to any patient. Chamomilla can be given to any patient who has intolerable pain. Who, I mean to say, even though the pain is small, they cannot tolerate. Okay, that is the main idea of chamomilla. The main essence or the main idea of chamomilla is the pain threshold of the patient is very less. Okay, even a very small pain will seem very much for them. So that is what it means. Pain seems unendurable, drives to despair. Okay, peevish, irritable, oversensitive to pain, driven to despair, and snappish, cannot return a civil answer. So what does this mean? See, all these are seen in a girl at precocious puberty if she has severe dysmenorrhea. If you ask her mother every time, is she irritable? No. When she has pain. Okay, when she has pain, she is peevish, irritable. See, the pain makes her irritable. The pain makes her driven to despair. The pain makes her to be snappish. And the pain makes her to not to answer properly. Okay, the main reason is pain. The anger comes from pain in chamomilla. This you have to understand. Okay, next, particular symptoms. See, this is very I also want to tell one more point here. Other irritable remedies like nux vomica. Nux vomica is also irritable, but in nux vomica, irritability is because of gastric disturbance. Irritability is because the mind is racing very fast. Okay, mind has so many thoughts. The nux vomica patient will not have control of the thoughts. There will be so many thoughts rushing in the mind, and that causes irritability. Okay, in nux vomica patient. In chamomilla patient, it is pain which causes irritability and pain which causes a person to scold you or back answer. And it is not like haughtiness in platina. No, platina is something different. Platina is, it's a kind of luxurious haughtiness. She feels she is the goddess. Platina. Okay, that is different, entirely different. Platina. But again, Lachesis is egoistic. Here, chamomilla is not egoistic. Lachesis ego is different. That is a super inflated ego that is combined with jealousy, suspicion. Lachesis patient has all these symptoms. But chamomilla, the main reason for irritability is pain. Okay, the different and other pain where there is too much pain, intolerable pain. One more what we can compare with chamomilla is coffea. But coffea patient is not irritable because of pain. That is how you differentiate chamomilla and coffea. Okay, when even coffea patient cannot tolerate pain, but that patient will not become irritable, angry, will not snap at you. But chamomilla patient, when in pain, will definitely become irritable, angry, snap at you, and will become desperate. Okay, this is what is characteristic keynote of chamomilla. Particular symptoms: uterine hemorrhage, profuse discharge of clotted dark blood with labor-like pains. Again, patient is intolerant of pain. Patient cannot tolerate pain. This is the main reason, main problem. So, chamomilla patient is thirsty and hot. Aggravation by heat, anger, open air, in wind, and exaltations. Amelioration, that is exaltation is extremes of anything. Amelioration by fasting, warm, wet weather, humid weather. Okay, that will make her better. This is about chamomilla. Next, phosphorus. So what should we say about phosphorus? Phosphorus patient is like you know phosphorus cannot be kept in the air. What happens if you keep phosphorus in the air? The compound phosphorus in the air simply gets diffused. That is, it gets oxidized very easily. That is why phosphorus will always be kept under water. Okay, the same way, the phosphorus patient is also very diffuse in nature. They perceive every impression. Okay, they take everything very personally. They are very sensitive. Adapted to tall, slender persons of sanguine temperament. Someday we will discuss temperaments also. Okay, different types of temperaments. So adapted to tall, slender persons of sanguine temperament, fair skin, delicate eyelashes, quick perception, and very sensitive nature. Oversensitiveness of all senses to external impressions, light, noise, odors, touch. Okay, next, particular symptoms. Menses too early and scanty, not profuse but last too long. See, this is very important. It is too early and scanty. Okay, it is early, scanty, not profuse, but it is very for a very long time. Say, for example, only one pad a day for 10 days. Okay, that is also menorrhagia, you know. So, one pad a day for 10 days. It is early, it comes at 21, 22 days, and it is scanty. Every day it is little, but it is for too long, for 10 days, 12 days, 8 days. That is phosphorus. Slight hemorrhage from uterus between periods. like ovulation in between the periods, like 1 week after the menses stops, again there is a spotting. Okay, then leukorrhea profuse, smarting, corrosive instead of menses. See, leukorrhea instead of menses. Say for example, she had her periods on 1st January. 1st February she was supposed to get periods, but she has white discharge, which is so profuse that she has to wear a pad. So you have to ask the patient when you take history, how what is the nature of white discharge? Is it so much that you have to wear a pad? Some people wear a pad and they think it is normal, but you have to ask and clarify. Okay, smarting, it causes burning. Smarting is burning. Corrosive, it causes itching, burning instead of menses. Leukorrhea is instead of menses. Amenorrhea with vicarious menstruation. Vicarious menstruation is bleeding from elsewhere. So the most common site is nose bleeding. Okay, so these are the particular symptoms. Of course, phosphorus patient is very thirsty for cold water. Even though the patient is chilly, she is very thirsty for cold water, and as soon as she drinks cold water, as soon as the water touches the stomach and becomes a bit warm, she feels like vomiting or she feels the pain. Okay, that is phosphorus. Next, thermals, chilly, aggravation, lying on painful side or left side, and during thunderstorm. See, thunderstorm is a natural phenomena, and most people will not get affected by thunderstorm, but such a small, what do you say, such a small stimulus also can cause such a strong reaction in phosphorus patient. That is what it shows, that phosphorus is oversensitive to all impressions. Okay, amelioration in the dark, lying on right side by being rubbed or mesmerized. See, even though the phosphorus patient wants to lie in dark, she wants company. She wants somebody to be with her in the dark. She because she has oversensitiveness to light. She wants it dark, but she wants somebody to be there. She cannot be alone in the dark. Phosphorus is very much phosphorus very much needs company and gets aggravated if there is nobody with her, or if like say for example, there was some program or some festival or something, and most guests have so many guests have come home. When all the guests go back, she will feel sad, she will have her symptoms. That is the kind of phosphorus, that is the kind of patient who indicates phosphorus. Okay, lying on right side by being rubbed or mesmerized, that is when she wants somebody to rub her back, rub her arms, rub her legs, she feels that. Okay, that is phosphorus. Next, pulsatilla, adapted to persons of indecisive, slow, phlegmatic temperament, sandy hair, blue eyes, pale face, easily moved to laughter or tears, obstinate, mild, gentle, timid, yielding disposition. See here also the patient is easily moved, easily, what do you say, moved to laughter, or even here the patient wants company, but it is very different from phosphorus. Phosphorus wants company to stay happy. Pulsatilla wants company so that somebody will give her attention. If so many people are there and nobody is listening to her, she'll not feel good. Pulsatilla patient wants somebody to listen to her. She wants attention. She wants, they should console her. They should tell her, oh, really, very bad is happening with you. Don't worry. She wants some consoling, some good words. But phosphorus is not like that. She wants everybody to be with her. That is a difference, major difference between phosphorus and pulsatilla. Okay, weeps easily, almost impossible to detail her ailments without weeping. See, this is here. She weeps to seek attention. She is very much attention craving. Okay, the first serious impairment of health is referred to pubertic age. See, she says, have never been since puberty. That is pulsatilla. Even in the in the repertory, if you see, okay, ailments after puberty or menses irregular from puberty, even though she is quite old enough, even if she has had from menarche, since menarche, even though if she has had menarche 10-12 years ago also, she'll have problems with menses. From then only it has started, from menarche only. Okay, so that is pulsatilla. Symptoms ever changing. Sometimes it is like this, sometimes it is like that. Pulsatilla symptoms are ever changing. Okay, and pulsatilla patient is thirstless, hot. And general modalities, aggravation in warm, closed room, evening at twilight. Twilight is sunset time. Amelioration in open air, lying on painful side, cold air, cold application. This is pulsatilla. Next, sabina. So the characteristic features of sabina. Chronic ailments of women. Sabina is prescribed when the ailments are chronic. Music intolerable, produces nervousness. Drawing pain in the small of the back. This is very characteristic of sabina in nearly all diseases. That is back pain, low back pain from sacrum to pubis. Low back pain from sacrum to pubis is very common in sabina patient. It is present in mostly all complaints. With all complaints, she has backache. Okay. Next, particular symptoms. Menses profuse, bright, hemorrhage partly clotted. That is, the menses is partly fluid, partly clotted. That is, partly bloody, partly clotted. Especially, she'll have bright red bleeding with dark clots. That is sabina. Okay. Pain from sacrum to pubis from below upwards, shooting up the vagina. Leukorrhea after menses. It is offensive, corrosive, and offensive. Again, it also causes burning. Discharge of blood between periods. One more remedy, discharge of blood between periods, was phosphorus. Okay. General modalities. Aggravation. See, here I have not mentioned thirst thermals because they are not particular for sabina. Okay. It is not characteristic for sabina. If I have not written, it is not that I have forgotten. It is not characteristic for sabina. That is why I have not written. Okay. General modalities. Aggravation from least motion, warm air or room. Amelioration, cool, open, fresh air. Okay. Next, silesia. Silesia is adapted to nervous, irritable, sanguine temperament, persons of psoric diathesis. Constitution which suffers from deficient nutrition, from imperfect assimilation. This means, see, the girl is eating well. The girl is given nutritious food. Okay, it is not that she has malnutrition. She has mal assimilation. She is not able to digest it properly. Okay, here the digestion has a problem. Imperfect assimilation means digestion has a problem and she is not able to absorb the nutrients from food, even though she is eating nutritious food. That is what it means. Okay, obstinate, headstrong, cry when spoken kindly to. See, silesia patient is also timid, but obstinate and headstrong. Outside, she is where she is timid. She cannot talk to strangers very easily. She is introvert, but inside she is obstinate and headstrong. Okay, like how the gut is obstinate, even though the food is nutritious, the gut is not ready to absorb. It is obstinate in absorbing the nutrients. The same way, mentals also, she is obstinate and headstrong. She cannot absorb. She will do what she feels like doing. That is silesia. Okay. Particular symptoms. A mild acrid leukorrhea. Sorry, a milky acrid leukorrhea, itching of vulva and vagina, discharge of blood between menstrual periods. See, a milky acrid leukorrhea during urination. This is a characteristic of silesia. Even I had a patient who had leukorrhea only during urination. With silesia, she was much better. Okay, she had leukorrhea only during urination. That is what I keep telling you. All these symptoms are not imaginary. They are all clinically verified. All of them have been seen in the patients and treated. And what do you mean by clinically verified? The patient was better with the remedy. The patient has come back for follow-up and better with the remedy. That is what it means, clinically verified. Okay. Discharge of blood between menstrual periods. Again, this also. Another remedy was done. Sabina, phosphorus, silesia. Increased menses with paroxysms of icy coldness over whole body. When menses is there, she has icy coldness over whole body. She has chilliness during menses. That is silesia. Okay. She is thirsty. She is chilly. Aggravation cold during menses, during new moon, uncovering, especially the head. She is so chilly. Silicea patient is very chilly. Like again, Boric says, Silicea patient wants to hug fire. That patient is so chilly. You cannot hug fire literally, but the patient is so chilly that she always wants warmth, or like warm climate or warm environment. Okay, lying down aggravates. Amylation, warmth, especially wrapping up the head. She'll feel much better wearing a muffler, cap, all those things. Okay, next. See, these were the remedies for precocious puberty. These are the remedies for delayed puberty. Okay, so first, causticum. Causticum is adapted to persons with dark hair and rigid fiber, scrawny, psoric with excessively yellow sallow complexion. So, causticum is robust persons. Materia Medica says robust, for robust persons. Okay, and they have sad mood, hopelessness from care, grief, sorrow. With weeping, least things make the child cry. Intense sympathy for suffering of others. See, these people, like also Kent says, intolerance to injustice to anybody or anything, even animals, or plants, any living beings. If some injustice is being done, say for example, you take a stone and hit the dog, causticum patient will cannot tolerate. That patient will take that. Other people like, okay, it's like you just hit the dog, it went away, that's all. But causticum patient will think so deeply that that stone hit the dog in some place, the dog is under pain, even the dog would have forgotten, but causticum patient will remember. That is the intense sympathy for suffering of others. That is the intense sympathy of causticum, and she will suffer because of that. See, what all the mental symptoms, emotional symptoms, what I've discussed till now in all the remedies. See, all of us have all emotions. All of us get irritated. With, of course, during pain we get irritated. Of course, we are to some extent stubborn. We do what we feel like. Of course, we want some company. Okay. Of course, we feel like talking to other people, and what do you say, like phosphorus get diffused. Of course we crave attention, but even then, see, these symptoms are extreme. There is a fine line between being normal and having a symptom. Okay, so being normal is, it is not that you get personally affected and you suffer from it. Okay, but having a symptom is you'll suffer from it. Okay, you may start having physical symptoms because of it. I told you, pain. That is, in case of chamomilla, pain. She will not even think what the other person would think if she shouts at that person. Or she's suffering so much because of it. Okay, because of that symptom. That is what makes it symptom. Normal is different from symptom. But there is a very fine line. There is a very small differentiation between the two. Normally we react and we get back to normal and we just continue. It is not that we suffer until unless we have that remedy predisposition. But when the remedy, if you want to give that remedy, the person suffers from it. Okay, next, particular symptom. Menses sees at night. This is very characteristic of causticum. Flow only during the day. Menstrual flow only during the day. Leukorrhea at night. So you can remember, menses at day, leukorrhea at night. This is causticum. Menses, there is no flow at night. Flow only during the day, leukorrhea at night with great weakness, menses delayed. So this is for delayed puberty. Okay, next, thirst. Causticum is thirsty and chilly. General modalities in clear, fine weather. So if the weather is clear and fine, that is spring, where it is nice, good outside, causticum patient will not feel better. cold air, on becoming cold, from getting wet or bathing. These things will aggravate the complaints. Amelioration in damp, wet weather, warm air, like rainy season, cloudy, rainy season, causticum patient will be happy, better. Okay. Next, graphitis. Suited to women inclined to obesity. Again, like Antim crude. Graphitis is also suited to girls who have delayed puberty and who have not attained menarche. Puberty is said to be delayed when if she has not attained menarche even at the age of 18 years and 16 years, and secondary sexual characters has not developed even at the age of 12 to 13 years. That is delayed puberty. So obesity. She has obesity, she has delayed puberty, habitual constipation with history of delayed menstruation. See, delayed menstruation. Okay. Unhealthy skin. See, this is a characteristic of graphitis which runs throughout the remedy. Unhealthy skin, every injury suppurates, old cicatrices, that scars, old scars break open. Scars break open from which oozes a watery, transparent, sticky fluid. Graphitis discharge is sticky in nature. Okay. Particular symptoms. Menses too scanty, pale, late. See, here menses is late and scanty. In phosphorus, menses was early and scanty for a very long time. Here, menses is late and scanty with violent colic, irregular, delayed from getting feet wet. Pulsatilla also has delayed menses from, suppressed menses. See, this is the difference. Pulsatilla has suppressed menses from getting feet wet. See, getting feet wet does not mean whenever she washes her feet, she'll not have menses. No, getting feet wet is working in water, like washing clothes, staying in water for a long time. Okay. Or girls, if they are playing in the water, staying in the water for a long time. So there in pulsatilla, it is menses suppressed because of getting feet wet. Here, menses is delayed because of getting feet wet. Okay, so that is the difference. See, this is how we have to study therapeutics and materia medica. When you differentiate remedies, you will definitely remember them. Okay, morning sickness during menses. See, in what is that? Antim crude, there was toothache before menses. Here, there is morning sickness during menses. That is, in the morning, she'll feel like vomiting. She'll have nausea. She'll have vomiting sensation, nausea during menses. Very weak and prostrated. Leucorrhea acrid. Sorry, see again, acrid, excoriating, occurs in gushes day and night, before and after menses. So here it is before and after menses. See, to some extent, before and after menses, leucorrhea is common. White discharge per vagina before and after menses to some extent is common. That is 1 or 2 days before menses, 1 or 2 days after menses, and 1 or 2 days during ovulation. And that too, that leucorrhea will be watery, non-offensive, it will not stick to the clothes, and when washed, it will not leave the stain. That is normal white discharge. Okay, that is normal white discharge. It will be a little, only a little. That's all. And when washed, it will not stick to the dress or it will not stick to the cloth, and it is very easy to wash, and it is watery. Here it is gushy, that is too much. She has to wear a pad. That is the amount of leucorrhea or white discharge in graphitis before and after menses. Okay, next, graphitis patient is thirsty, chilly, aggravation at diet during and after menstruation, amelioration, open air, cold application. So this is graphitis. Next, Baraita carb. Baraita carb patient. What shall I say about Baraita carb? Baraita carb is retarded patient. Okay. It's like, see, his mother says, how much ever I teach her or how much ever I have given her, like I have joined her to tuitions, she has been getting extra coaching. Even the teacher, when I go to parent teacher meeting, says she is not up to the mark. Even she will struggle in studying. Even she'll do very much hard work. But even then she'll not get marks. Okay. That is low IQ. Intelligent quotient itself is less in Paretakar patient. Okay, that is the problem. Retardation, both physical and mental. I mean to say, mental retardation does not mean total mental retardation. They are idiots. They cannot grasp things easily. They cannot hold things easily. They cannot reciprocate or what do you say, recall back things easily. Got it? So that is memory deficit. And along with all these, they are very peevish. That is, they are very timid. That is why, see, because of all these only, because their mental ability is low, and because of all these things only, they're always clinging to their mothers. They are very much dependent upon their mothers. They cannot take decisions on themselves with about like on they themselves cannot take any decisions by themselves. They cannot decide even small things. They cannot decide. They have to ask their mothers, or they have to depend on somebody. Say for example, she is married, she has to ask her husband or somebody, like she has to depend on somebody even to take decisions, even very small decisions. Say for example, what should I cook, what should I bring, even such small things, small details also, she is dependent on somebody, because she has this less IQ. She is forgetful, she is inattentive, she is a bit idiotic. That is the problem with Baraita. Okay, tendency to take cold easily. With every, even the least cold, have an attack of tonsillitis. So they'll have, see, say for example, in this scenario, delayed puberty in girls who have memory deficit, who cannot study, who cannot retain anything, who are below average students, and even with a small exposure to cold, they'll have tonsillitis. So this is a perfect combination for Baraita. Okay, so this is how you have to apply. Okay, particular symptoms: dwarfish. See here, Calcarea phosphorus tall, Baraita carbis dwarf, very short. Hysterical women and old maids with scanty menses, deficient heat. She is chilly, always cold and chilly. Okay, but Silesia patient also is chilly and stubborn. But Silesia patient has a very good IQ. There is no deficient memory. Okay, they are not mentally retarded. Most of the Silesia patients are not idiots like this. Okay, but Baraita carb is like this. The least cold have an attack of tonsillitis. Before menses, pain in stomach and small of back. Of course, Baraita carb patient is thirsty and chilly. Here I have forgotten to write. Of course, Baraita carb patient is thirsty and chilly. General bronchitis, aggravation thinking of disease, lying on painful side, after meals, washing affected parts. Amelioration, warmth in general. Okay, next, Kali carb. Weakness is the weakness which is characteristic of all potassium salts is seen in Kali carb, with soft pulse, coldness, general depression, and very characteristic stitches, which may be felt in any part of the body or in connection with any affection. They have stitching pain with weakness. The weakness. See, there is a triad of symptoms in Kali carb. 3 symptoms: weakness, pain in the back, and coldness. So these are the characteristic symptoms of Kali carb. Pain in the back with weakness, and sweating and prostration. These are the common characteristic symptoms of Kali carb. Cannot bear to be touched. Starts when touched ever so light, especially on feet. She cannot bear to be touched. If somebody touches her, she starts like this. Starting is like jerking. Okay, bag like swelling between upper eyelids and eyebrows. Upper eyelids and eyebrows. Particular symptoms: menses early, profuse, and too late. Menses, if it is early, it is profuse, or if it is late, it is pale and scanty. If it is early, it is profuse. If it is late, it is scanty. Okay. Soreness about genitals, pain from back passed down through the gluteal muscles. So pain from back, that is from sacrum to pubis, is sabina. So pain from back going into gluteus, that is buttocks, is Kali carb. Okay. Delayed menses in young girls with chest symptoms or ascites. Say for example, the girl had some chest affection. She had pneumonia, she had any other acute respiratory distress syndrome, or she has asthma, she had, or in the childhood she had tuberculosis, any chest symptom. The girl has not yet attained menarche. or the secondary sexual characters are not developed, then you can think of Kalikar. Okay, these are the characteristics of Kalikar. General modalities: aggravation, cold weather, in the morning at 3 a.m., lying on left and painful side, amelioration, warm weather. Again, Kalikar patient is thirsty and chilly. Okay, natrum mure. Next, natrum mure. Natrum mure, great emaciation, losing flesh while eating well. Marked disposition to weep, sad weeping mood without cause, but consolation from others aggravates her troubles. See here again. See, natrum mure patient, you can see in the repertory it is ailments from grief. Natrum mure is 3 plus. The difference between natrum mure and phosphorus. See how phosphorus is very sensitive to outside impressions. They will take all impressions and they will again diffuse it, give it back. That is phosphorus. But natrum mure is, you know how salt absorbs water. That way they'll absorb everything, keep it inside. That is a difference, major difference between phosphorus and natrum mure. Okay, phosphorus patient will take and give, but natrum mure patient will take, keep, brood. Inside only they'll suppress. They keep on thinking about that only. That is natrum mure. They get affected, next they'll not speak to anybody. Once they are hurt, phosphorus is like, even though they are hurt once, they'll go back, they tell them, you have hurt me. And they'll forget it, even though they get hurt so many times. But natrum mure is not like that. Once or twice hurt, they'll not talk to them again. They are afraid that they may get hurt again. That is natrum mure. Okay, phosphorus will not scold or will not talk bitterly. Okay, phosphorus will say, yes, you have hurt me. And once if that person apologizes, again she can be friends with that person. Natrum mure is like, once or twice hurt, she'll close herself. She'll not talk to that person. But it is not that she'll talk bitterly to that person. She'll not scold or do something. She herself, she'll become quiet. She'll become she'll close herself. But nitric acid patient will scold back very badly. Okay, with vice. And that too, nitric acid patient will carry it for a very long time. She's like, whenever she sees her, she'll say, no, you have done this. And that too, in a very bitter way, she'll give back. That is nitric acid. There is a difference between phosphorus, natrum mure, nitric acid. Okay, particular symptoms: menses irregular, usually profuse, dryness of vagina. See, salt causes dryness, right? Wherever you put salt, there is dryness because it absorbs water. That is how there is dryness. Again, also there is dryness in the mental plane. Okay, that is why they don't want consolation, because they cannot take more impressions. They don't want to get hurt more. They don't want to take it more. That is why they develop that dryness. Okay, and it is also reflected in the physical thing, vaginal dryness. Leukorrhea, acrid, watery. That is why natrum mure can also be used in atrophic vaginitis, senile vaginitis, or in girls who have itching, burning, repeated UTI. Okay, because again, dryness. Okay, leukorrhea, acrid, watery. Hot during menses. The patient feels very hot during menses. Hot during menses means not she's on fire. Hot during menses means she feels hot during menses. She wants fan, she wants to take off covering, she wants AC, she wants to be in open air during menses. Okay, she's thirsty, hot. General modalities: aggravation 10 a.m. or 11 a.m. at seashore, heat of sun or stove. She's a hot patient, of course. Writing, reading, lying down. All these causes aggravation. Amelioration in open air, cold bathing, going without regular meals. She cannot eat regularly. If she eats regularly, she'll feel bad. Lying on right side. So these are the general modalities of natrum mure. Next, Senecio aureus. This is somewhat like it is like a specific remedy. I've just chosen this because first point is definitely it was given 3 marks in Kent repertory for delayed puberty, and also other is like you cannot always rely on character, like that is specific remedies. But specific remedies, sometimes when there are no other symptoms at all, the patient does not have any other symptoms at all, there is only pathology, in such cases you can use specific remedies. Okay, characteristic keynote, female organism has been clinically verified, it is only clinically verified. Menses retarded, suppressed. Functional amenorrhea of young girls with backache. Before menses, inflammation of throat, chest and bladder. So here there are more of bladder complaints. Anemic dysmenorrhea with urinary disturbance. Premature and too profuse menses. So these are the complaints of senescence aureus. Okay, so this is about today's therapeutics. Hope you learned something today. Okay, and again we will meet tomorrow for surgery class at 7:30. Good night.